After dimpleplasty that has failed, when can dimpleplasty be done again? My question is, how many months after I did this dimpleplasty can the surgery be done again? Thank you.
Thank you for your question. You submitted your question with several photos and essentially are asking how many months after you underwent dimpleplasty can you have the procedure redone? Well, I can certainly share with you my experience performing this procedure. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've actually become well known for dimpleplasty. We've been featured in the media, and people come to us from all over the world for dimples. So I can certainly share with you how I explain this procedure and what I do when enhancement is indicated. So to begin with, concept of dimpleplasty is basically to create a natural appearance where there is a connection between a muscle that lines the inside of the mouth called the buccinator muscle and connecting that with the skin, so that when you smile, you get this nice natural dimple. Now, interestingly, for something that seems fairly straightforward in concept, is actually not that straightforward in execution. The procedure has different variations. I like to think that what we've done in our practice has been an evolution of this procedure and results in a pretty consistent rate of success. But we're working in such a small opening inside the mouth, and the variables that affect outcome include things such as relative thickness of the skin, the amount of fat under the skin, the elasticity of the skin. There's a few variables, and of course the technical aspect of connecting with a stitch between the external skin and the muscle on the inside and getting a nice natural symmetric result. Now, sometimes what happens is, even though it looks good on the operating room, some variables can cause the dimple to release. And that could be everything from the suture not engaging the tissue or separating. Swelling can have an impact, movement can have an impact. And so there is certainly an opportunity to enhance this procedure. So when this patient comes up, when this question comes up from our patients, basically I examine them, and I'll usually find the following. During the first few months, there's still some healing process going on in the area that was operated. And that healing process is marked by the presence of almost like a nodule or a hard-ish area that can be felt when you place your finger on the inside of the mouth and put pressure on the outside of the cheek. So with your index finger and thumb, you can feel like this little bump. And usually what I tell our patients is that's still an active healing process. Now, technically, you can probably do this almost any time, but I generally recommend doing this when swelling related to healing, inflammation related to healing is stable. And so, as a rule of thumb, I'll tell our patients that after 3 months, that's probably a time that it's reasonable to go ahead and do the procedure. Some people who travel, sometimes the challenges of timing can require that we sometimes expedite things. But I would say waiting around 3 months is a good rule of thumb. And if there is any concern or question about the level of healing or any inflammation or other issues, then certainly those particular concerns are dealt with on a case-by-case basis. And then once that healing and swelling has resolved, it is relatively straightforward to go back and reattach the skin, and hopefully the dimple will work out favorably for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.